It is my pleasure to be here today to welcome you all to this vital conversation around recovering and moving forward and growing after the trauma of COVID-19. So take this moment, take a deep breath in, prepare, get settled, get your coffee, whatever you need, and get ready to be engaged, as there will be plenty of opportunity for answers and questions and to get you engaged and in this process along the way. Now, I will not lead this conversation, but leading us in this conversation today, our keynote speaker is Lori Borderer. Lori has a master's degree in psychology from Harvard University. She's nationally recognized. She started this nationally recognized Jacob's Heart. Is an organization whose mission is to improve the quality of life of children with cancer and support their family in the challenges they face. She is the co-founder of the Children's Hospice and Palliative Care Coalition. She's been awarded the Oprah Winfrey's Use Your Life Award and the 2019 Women of the Year from Pajaro Valley Chamber of Commerce. Now that short bio does Lori no justice, but we have a tight program and we got to keep moving. So we invite you to follow Lori and her work at Jacob's Heart, as she's a role model for a strong, courageous advocate who wholeheartedly dedicated to being an agent of change. So without further ado, Lori Butterworth.
Oh, thank you. Thanks, DeAndre. Let's give him a round of applause. That was great. Thank you. You set the stage very well for our conversation today. I'm going to go ahead and share my screen, and we're going to have some time together to, oh, wait, there's my other screen. You get to see my family for a minute. Does everybody see my family right now? Here we go. How's that? Okay, here we go. So let's, we're gonna have some time together. It's so great to see everybody. I'm seeing all your faces on the Zoom screen. I look forward to next year and years coming that we can be really together in face-to-face person. I know we're all kind of fatigued of Zoom meetings, but I make a commitment to make the most of your time today. You know, you're sharing your most precious resource. You know, our most precious resource in life is our time. And so I'm going to try to make really good use of it so that you can come away with some practical tools, evidence-based strategies, and ideas for restoring our community's sense of safety and security. Now, I'm going to use theory, and usually when people think about theory and learning about theory, it's kind of boring, but you got to trust me on this. These theories give us the grounding and the evidence-based structure through which we can heal. So trust me, these are really great theories. They're what drive our work at Jacob's Heart, and we're going to get a snapshot of them so you have them in your toolkit as we move on with the goal of healing and becoming better after COVID. So actually at the end, we're going to try to do a real-time assessment of what our community needs and what we all can do to further this growth. So here are the theories. Now, these are 3 human development theories. These are seminal theories. These are the theories that seeded, that put, you know, seminal theories are the seed theories from which a lot of research happens. So Maslow's hierarchy of human needs. I know so many of us are familiar with Maslow in some way. It might ring a bell. We're going to be talking about this. I'm going to be applying this theory to crisis, how to use this in a crisis. I think someone has, if you can all mute and get a little bit of background noise. Got it? Can we mute? Awesome. Thank you. Okay. So Maslow's hierarchy of human needs is the first. The next is Joseph Campbell's hero's journey. We'll use that as a framework. And then post-traumatic growth. This is the burgeoning construct known as post-traumatic growth, which is the goal. Okay, so with that, let me just take a moment, and DeAndre talked about this a little bit. Let's make sure that all of us are supportive of one another today. We're going to be talking about trauma. We're going to be talking about challenges and difficulties. We're going to be sharing some stories, and really just take care of yourself and know that it's okay to check out, to turn your screen off, whatever feels really safe and secure for you. we're going to be breaking into some breakout rooms. And if you want to share, great. If you don't, if you want to observe, that's great too. So we got your back here today. All right. So I'm going to start. We're going to learn a little bit about Maslow. So Maslow had this idea that human needs are sort of structured, that there are lower level basic human needs that need to be met before building upon the next human need. And that the satisfaction of one human need is needed in order to restore the next. Okay, let's give you some examples because this will make sense in our real life. I'm going to use Jacob's heart as a model for showing how we apply this theory to people who are going through incredible difficulties. So looking here, okay, basic survival needs. This is the bottom rung of Maslow's pyramid. I want to share a little story with you as we kind of think about basic human needs and in times of crisis. 23 years ago, I went into a hospital room and saw my friend, Angel, and her daughter and her son, Jacob. And we met eye to eye, mom to mom, in that hospital room. Her little boy, her only child, had been diagnosed with acute myelogenous leukemia, which is one of the most deadly forms of childhood leukemia there is. And I looked at her eye to eye and I asked her a question. And I said, what do you need? I've learned that that's a ridiculous question. She didn't really know how to articulate what she needed in that moment. And because what she really needed was for her little boy not to have this illness. So I asked another question and I said, well, what are your immediate concerns today? What are you concerned with right now? And then she realized, and she could identify a need. I can't leave him alone. He's only 5. And if I leave him alone, I just can't bear that. But if I don't go back to work, we'll lose our insurance and then we'll lose our home and I won't be able to pay the bills. So this was her dilemma. Her concern in that moment of trauma and despair was basic survival needs. And if you think about this, people, when a trauma hits, a crisis hits, we usually do go back to the concern about basic survival needs. Those are food, clothing, and shelter. So, think about us in this time of COVID. I don't know about you, but a lot of us just went back down to let's hit the ground running, basic survival needs. At Jacob's Heart, we focused on this rung of this pyramid. Now, once those basic survival needs are addressed or met, sometimes they're not always addressed, but at least met, people start to feel safe and secure in the world. We talk about, in healthcare, we talk a lot about the safety and security of access to healthcare. We also talk about access to affordable health insurance. And at Jacob's Heart, we know that safety and security, trust in the world, gets ripped from you when your child is sick or when there's a crisis, even like a global crisis. It rips at the safety and security of individuals and the communities. Once we can restore our sense of safety and security in the world, that's where we start to form community. That's where we have family, friends, love, and belonging. At Jacob's Heart, we bring people together who have a shared traumatic experience, an experience that nobody really on the outside can understand. But being with people who share your experience is very, very healing. So that's where that whole idea of community comes in. And then we can start to look at emotional impact of trauma. Maslow talked about emotional well-being being the next rung. You think about it. If a family came into Jacob's Heart, or if I started to talk with Jacob's mom in that day about the emotional impact his disease was having on her, it's not even a relevant question. You can't think about that if you're worried about what's going on down here. So we need to, I think this is really the idea of, we talk about meeting people where they are, And knowing where someone is in terms of basic human needs is so important to really address those needs in a meaningful way for people. And so the apex of this hierarchy, the goal, the ultimate goal, according to Maslow, was self-actualization. And that's really a human being's ability to live their fullest life as themselves. But people in crisis don't really think about self-actualization. What we're really thinking about is hope. So I want you to just kind of think about this, kind of put a pin in Maslow for a minute. We have that concept. We think about all the ways we can apply this to our community, to ourselves, to issues. And we're gonna hold on to that because I want to move on to the next thing. Okay, thank you for muting. Okay, so so now I'm gonna give you a little quiz. This is the first quiz. Now what I want you to do is I'm gonna invite you all to go into the chat, open up your chat function, okay? And we're gonna look at it. I'm gonna open up my chat so I can see what you're saying. Okay, so let's, here's your little quiz. Okay, so what do Dorothy from The Wizard of Oz, Odysseus from Odyssey, Katniss Everdeen, Luke Skywalker, and the little engine that could have in common? Anybody know? Yeah. Resilience, hope, yeah, strength, hero's journey. Yeah. Great, thanks you guys. They believed in themselves, perseverance, power. They believed, resilience, not giving up. Okay, so what they have in common, you guys are all really close. I think someone actually got the word I was looking for, but there's lots of right answers. They're all right, okay? Belief that they could, yeah. So what happened with all these and so many other studies, right? And so many other stories is they all follow the same path. And this is the hero's journey path. Now, Joseph Campbell, I don't know how many of you have heard of Joseph Campbell and his work around the hero with 1,000 faces. He looked at stories from all different times in human history, from all different cultures, and he found similarities. And so, he called it the monomyth because there was so much similarity in the experience, right? So the good news about this is this path, and we're going to learn about it, this path that we tend to go through during a challenging time has a lot of similarities, and we don't have to risk this adventure alone. We don't have to go through it alone because heroes of all time have gone before us. And the labyrinth is thoroughly known. We only have to follow the thread of the hero path. So I'm going to show you the hero's journey. We're going to walk through it. Knowing where you are in a process of addressing or coming out of a challenge, that in and of itself helps you know you're not alone because someone else has forged that path before, maybe on a different quest or through a different type of challenge than you're going through. But truly, it's something that you realize that you don't have to go through it alone. I use this a lot in counseling teens who have gone through cancer. And teen cancer survivors, the aftermath of treatment, we use this to help teens understand what they've been through and then perhaps mentor other teens who would go through this. So let's look at the hero's, this hero's journey here. Okay, so I think the best way for me to think about this is to think of it as a clock, okay? So let's imagine, here we are, 12 o'clock. So you see how this kind of looks like a clock in here? So because there are 12 pieces to this, so it works to make it a clock, right? So 12 o'clock, you're in your ordinary life, minding your own business. I'm going to use a teen with cancer as an example here. The crisis calling. 1 o'clock, you hear the words, you have cancer. You're 13, 14 years old. Denial, refusal. Whenever we're hit with a crisis, denial. I think about me during COVID. First thing I did was deny it. This can't be happening. It'll be over by May. That was May 2020. denial, refusal. I don't have this. This isn't happening to me. Then you realize, yes, this is happening and I've got to deal with it. And that's when you cross the threshold. We cross the threshold into the other world. You think about the hero's journey. You think about Katniss when the calling, when she heard her sister's name called, she made the choice. I'm going to take this on. And then the denial and the refusal, and then going to the capital, right? Remember all this? This is the same type of story. You're crossing the threshold. You're going into this cancer world or this crisis world where you're going to meet the challenge. Before you meet the challenge, you find out who your allies are, who your enemies are. Allies and enemies in the hero's journey and all these stories, you remember them, all these people or things. I like to talk with the teens or with ourselves and people about thoughts and beliefs and behaviors that we have that are allies, and some of them are enemies. So this has to do with our friends in physical people or friendly thoughts that are going to help us get through. I think that, the term, you learn who your real friends are when you're in a challenge. That's this time. Any of you that gone through something really hard, you know who your friends are in it, who your real friends are. And then the approach into the worst part. I'm going to tell you about a boy, Andrew, when he was going through cancer. He was 15, osteosarcoma. And we went through this whole hero's journey path with him to help him, learn how to get better from it. And he talked about the approach, and he talked about the abyss, the pit, the worst time in his cancer when he thought that he was going to die. And at that point, he wanted to die. He was just done. And then at that point, he met an ally who helped him lift him out of this pit, to continue with the treatment, to go on. And there was a glimmer of hope. That's when you start to see, okay, I can start to get out of this. There's a glimmer of hope that helps me see through a new lens where I might be going. The boon is the treasure, what you learn from the tough experience. And then you bring it back. You go back to the road, back to your ordinary world, right? And what happens when you go after a traumatic, and it doesn't have to be defined as trauma, a difficult endeavor in your life, you go back and you become the master of two worlds. You know what it's like in the ordinary world, but you also know what it's like in the other world. You know what the cancer world is like, and you know what regular life is like. You become the master of both. So here's the choice point. See this line right here? You can go back after a traumatic event. You can go right back to ordinary life. So many people say, after COVID, I just want life back to normal, and I'm going to get back all the normal things. Or there's a choice point here where we can emerge at 11 o'clock. And we can share that special knowledge. We can use that special knowledge to help ourselves and others learn from it and get better from it, so that we can emerge triumphant and be better after the trauma than we were before. And right here, this is where we find post-traumatic growth. So this hero's journey, I'm going to give you just a moment to think about it. And just think about if you've ever applied this, and think about if you're going through something, how it might help kind of identify where you are and where you may be going, and the choices that you have along the way to turn a traumatic event into growth. My mom always used to tell me, situations can make you bitter or better. It's up to you. And we have to do this with courage. And courage is defined by, courage comes from the root of the word heart. And it's sharing your special knowledge, sharing what you know with heart. And one of the people that does this so well, and I've known Gina Castaneda for a long time, and she's able to share her journey with heart, with the heart, open heart, I'm gonna tell you my story. I'm gonna give you the privilege of hearing my story because I believe with my heart that it will help you, and we can pave a better way together. So we're gonna take a moment and we're gonna listen to Gina's story. And as you're listening to Gina talk, be thinking about Maslow. Remember I told you to put a pin in Maslow's hierarchy of human needs. Kind of be thinking about that structure of needs and where basic needs were disrupted and kind of human needs were disrupted. And also think about the hero's journey. And let's go ahead and listen to our dear Gina.
Hi, my name is Gina Castañeda, and I'm here to share a little bit about my story. My good friend Lori and I talk about my story, and she always tells me how my story is the hero's journey. So today I just want to share a little bit of that. When I was born, I was taken away from my mom and put into foster care. I was in foster care for approximately a year and then returned back to my mom. I remember as a child not having enough food at the house to eat, and when there was food, we fought for it. But just the basic needs, I didn't have them. I didn't feel warmth. I didn't feel love. I didn't feel safe. I was always searching for some security, some love, some comfort, a safe place to be. I remember at 6 years old, my life changed. One day the phone rang and they asked for my mom. I remember she was asleep and I ran to her to wake her up, to give her the phone. When my mom woke up, she hung up the phone and my mom beat me. I remember being punched in the face and kicked and dragged by my hair. I remember my hair being ripped out of my skull and blood being on my hands. And I remember crying. When my mom finally stopped, I remember going to my room and being confused. Why the person that I loved so much in my life could inflict this much pain on me. This was happening not just to me, but to my brothers and sisters too. My life just kept getting worse. At the age of 11, my mom separated from my stepfather, Ernesto, and we became homeless. I remember walking the streets of Watsonville, going to the plaza, eating hot dogs from the hot dog stand because it was the only thing that we could afford, and being really lucky if I got a bag of 25 cents Cheez-Its. I remember having to leave the plaza with my mom and trying to find a place to sleep and walking down past the police station to the levee in front of the bars to the back of Ramsey, where we would try to be the first family in the monkey or the train. I don't know what my mom was looking for. I just remember being hungry, cold, unsafe, and really scared. I always went to school. People think that I went to school because I knew education was the key to saving my life, but it wasn't. I went to school because I was looking for a place where I felt safe and I could feel security. I was looking for a place where I could just be and not be scared. I was hungry. They had breakfast and they had lunch, but I remember leaving the school and feeling unsafe and not knowing where that I would sleep that day and that night. I remember coming to Watsonville and not being able to find my mom. And I remember going to the plaza and sitting there for hours, sitting at the bus bench, walking to the levee, coming around to the back of Ramsey, sitting at a bus bench and just waiting. And truthfully, I thought that I would never see my mom again, that she would be dead underneath the bush at Ramsey Park. That day, there was a man that came to my aid. He was a gang member. He was my brother's friend. He was a family friend. I remember him taking care of me all night and buying me something to eat. And the next day, him giving me money so that I could ride the bus. He said, go to school. Don't worry about your mom. I'm going to help you. I remember coming back to Watsonville and just being scared to death. He found me. He had found my mom, and he said, come with me. And we went to his house. He lived in a junkyard. We had to cross this drainage pipe to get to his house. I remember his trailer in the junkyard, where, although it was nothing, was the first place in a long time where I had a roof. I felt safe. I had a place to sleep. And there was some kind of normalcy in my life again. At that point in my life, I could see what was happening around me. I could see the addiction. I could see the drugs. I could see the violence. I could see the hurt and pain that not only myself, but my family and the people that were around me were going through. I knew that I didn't want that in my life. I remember at one point, this man asked me to carry drugs and weapons for him, and I refused. And when I refused, I remember taking the beating of my life and having to be homeless again. That beating wasn't even as bad as the beating my mom would give me later on, because we didn't have a place to live anymore. I was back on the streets and I was unsafe. I was hungry and really had no place to go. People ask me all the time, when was my bottom? My bottom was when my mom and I had to open dumpsters at the back of restaurants and pull food out to be able to feed ourselves. That was truly my bottom. When I had no place to stay, no food to eat, no place to go. I remember the first person in my life that started to speak light into me was my stepfather, Ernesto. I remember he used to tell me, don't listen to your mom. You're good. You're going to be great. You're going to make it. I remember in middle school, I had a teacher tell me that I could make it, to reach for the stars, that they were in my reach. When I got to high school, I had a coach and an athletic director that believed in me. They took the time to listen, to care, to have a safe space, to feed me. I felt growth. For the first time in my life, I knew that I could accomplish something. When I started playing team sports, the team sports filled the gaps in my life. I felt from the team love, support, security. For the first time in my life, people were cheering for me. I knew that I could make it. My athletic director repeatedly told me that I could graduate. He said, you'll be the first one in your family, but you can do it. I remember my mom didn't go to my graduation. My father didn't go to my graduation. My stepfather showed up for me, and so did my coach, my athletic director. Not only did they show up for me, my athletic director guided me, paid for my cap and gown, gave me a congratulations card, and said, this is just the beginning. That's when I transitioned my life into my next step. I knew then that I could make it. For I had learned to survive on the streets, and I was also learning these other skills to be able to move myself forward. I'll never forget the hurt and the pain. I'll never forget the trauma, the violence, the addiction, the drugs, and the abuse that I saw and that I went through. It just made me a stronger person. I took that and I moved myself forward, pushing myself to want to be better, and not only pushing myself to want to be better, but making a commitment to my family, the family that I did not have yet, to my future husband. and to the children that one day that I would have, that I would never have them go through anything that I had to survive, that I had to live through, and that I would make my life and their lives better, that they would feel love, safe, security, that they would have their basic needs met, and that I would take it one step further, and they would have love and happiness in a future. Once I made that commitment to myself, I knew that there was a need out there in the community. And I started to do work in the community as a peer educator, as a health educator. But I really found a calling when I started to work with families that were involved in gangs. I saw kids that were living the same life that I was living, families that were struggling and living through so much pain. I really wanted to make a difference. I started to work at the jail with adult men that were addicted to drugs. And I could see their girlfriends, their wives, and their children coming in to visit them. And I could see the same pain that I lived as a child. Later on in life, I got recruited to be a probation officer. I never wanted to be a probation officer. It's not something that I strive to be. I remember law enforcement being something that I couldn't trust. That's why I walked by the police department every single day and felt like I couldn't knock on the door and ask for help. But now, as a law enforcement officer, I have championed my life to be the voice of the forgotten, stand up for justice, and to move families forward so that they also can have love and support and feel happiness in their life.
Let's all just take a moment. Gina, I don't know if you saw the kind remarks in the chat about Aztecas and the incredible work you've done in the community. You're an amazing leader. It takes a lot of courage to share your story, and it resonates with me so much. That was from Viviana. So I want to make a statement that in my definition, Gina is a hero. So let's think about what defines a hero. And if you want to put in the chat, or if you want to raise your hand and talk, here's what I'm going to do. I'm going to stop my share for a minute. We're going to try this out. I hope this works okay. So we can see everybody. If you can put yourselves in gallery view, look at all those people. Wow, this is great. And we could have a little talk with Gina. Gina, thanks for joining and thanks for doing that. Just about what we saw in terms of a hero's journey, what might make Gina embody the definition of a hero, and what you noticed about basic needs. We talked about Maslow's hierarchy. What did you notice about when needs aren't met? Does anybody want to raise their hand? And thanks for people that are writing in the chat. That's really nice. We'll save this. We'll be able to save all of this for you. And I think, Gina, you'll love to see it. Did any of you notice, according to Maslow, disrupted human needs in Gina's story? Yeah. Anybody want to share? It was just such a compelling story. Gina, you're getting these messages, helping others better their lives through your strength and courage. Yeah. You didn't have food. You didn't have that sense of connection. That love and belonging that we all need. And yet you wove your way through your journey, your hero's journey. And at that 10 o'clock, remember we talked about the 10 o'clock choice, that 10 o'clock choice, when you're going to go, am I going to take my life and just become just like the ordinary life that I grew up knowing? Or am I going to make a choice to emerge triumphant? to share my special knowledge, that special knowledge that one comes through a traumatic event and series of events like that. It's that time when you choose to rise above it, to come out higher, up, and better than you were before. So thanks everybody for these comments in the chat. Please take a minute to read the chat. All right, and then I'm gonna try to reshare my screen. I didn't plan on taking us all back, but I wanted to see you all. So let's see if I can do this. Yes.
Hey, Lori, Rebecca has her hand raised.
Oh, Rebecca, go ahead, please. Please speak.
Good morning, everybody. What I wanted to mention for those of us that have known about Gina's story for years and years and seen her go from the basic survival needs to hope, what was missing from the story is in terms of her post-traumatic growth and all that she does as a result of her journey. And that more of us need to go from not just the healing of ourselves, but then how do we share that healing with others? Yeah. So I just wanted to share that.
Thank you. Yeah, that's that going from this, you have this knowledge, but you're going to share it, and this emerging better. One of the indicators of post-traumatic growth is your willingness to share with others. And then the idea around the hero's journey is, now that Gina has reached this post-traumatic growth apex of the hero's journey, then that prepares one, then become willing to walk. Look at how, in Gina, in your life, when you're walking with all those people, former gang members, drug addicted, walking through them, meeting them, the willingness and the courage to meet someone at this pit, at the abyss, and being with someone when they're in this, and being the glimmer of hope for them, and you're guiding them. So the journey is the guide. Remember Joseph Campbell's quote about, you realize that you don't have to go through the journey alone because heroes have gone before you. You just need to follow the thread of the hero path. So this whole idea of post-traumatic growth, let's learn about it, and let's figure out how we can really nurture this in our community. And I want you to think about Gina's story too when we read this quote by Viktor Frankl. Now, if you haven't read Viktor Frankl's book, Man's Search for Meaning, I just can't recommend it enough. It was one of those books, those kind of books that just really change your life, and sparks go off, sparks of wisdom go off all the time. So Viktor Frankl, he was a victim of the Holocaust. He was in Auschwitz. He lost everything. He lost all his family. He lost his wife. But what he didn't lose was his ability to choose his response to the treatment. And here's a quote from him: "When one is confronted with an inescapable, unavoidable situation, whenever one has to face a fate that cannot be changed, what matters most of all is the attitude we take towards suffering." Gina just shared with us her choice, that we would take this experience, and I'm not going to let it happen again. I'm going to make a commitment to, I'm going to change my attitude towards a positive response to it. I'm going to respond in a positive way and help others. That's the choice point. Viktor Frankl, another quote thing he described was stimulus between in the concentration camp. He couldn't control the stimulus, the treatment, the way he was, the way they caused so much suffering. He couldn't control that. That's the stimulus. But what he could control was his response. We have the stimulus and response. And he talked about how between the stimulus and the response, there's a space. And in that space is choice. When we're looking at COVID and what we've been through, this collective trauma, this collective challenge that we've been through, there are things that we haven't been able to change, inescapable, unavoidable situations. That's the stimulus. But what we do have control over individually and as a community is our response. So we're going to dwell in that space for just a few moments as we figure out how we can create in our community from this group of people. I know, Margaret Mead said, it takes a small group of people to change the world. That's the only thing that ever has. So let's take a look at post-traumatic growth. And remember I told you that some people think theories are boring, but they're not, right? They're inspiring if we can really apply them to life. So Tadici and Calhoun, they studied post-traumatic growth as a phenomenon, as a psychological phenomenon. We know all about post-traumatic growth stories. That's what the hero's journey whole thing is, right? It's a post-traumatic growth story. It's someone who's gone through a trial and come out better, come out heroic. So, but Tadici and Calhoun, they started to like chunk things and find things in categories that we could understand it. So that's all this is. This is not like a specific formula we have to follow. It's just putting things together so that we can frame them and understand them and use them. So there are 4 factors that can lead one to growth after a challenge. And you think of these as certain conditions and states of being that one has or can acquire to help bring about growth in the wake of trauma. First and foremost, the sense of control. So when someone loses their sense of control, they're less likely to emerge, better for the trauma, right? Positive coping style. Gina demonstrated her positive coping style in her ability to reframe the experience. Look at the positive coping style is the ability to look at an experience through new lenses. We're going to change our lens and we're going to look at it in a positive way of being able to cope. Social support is so important. And to bring that to light, you think about the veterans coming back from Vietnam and the lack of social support. It wasn't just the social support. They were just like emotionally annihilated by the public, by many of the public, not all, but by many people when they came back. So not only did they feel a lack of support, they felt this disconnection from why they were there. And so that's why that manifested so much PTSD, because they didn't have that kind of support. And then that positive sense of self. If we can regain a positive sense of ourselves and a positive sense of our community, because so many of these have gotten disrupted during COVID. Sense of control, positive coping style, social support, and positive sense of self. Okay, so hold on to those. And what those will manifest after the trauma there's 5 domains of growth. So think about this: better relating to others, new possibilities. Can a challenge show you new possibilities? Personal strength, a redefinition of personal strength, belief in yourself, spiritual, existential change that comes from a challenge, and then a deeper appreciation for life. When we work with teens who have gone through cancer and they start to look at their experience, we use the hero's journey, but we also use this post-traumatic growth theory where we think about, did this experience bring personal strength to you? No, they'll usually say yes. Like those, and so I'm going to show you, we're going to introduce you to a tool. And those of you who downloaded, there's a packet on the Community Health Trust website where you can get worksheets of all these. Just take them, use them. And I'm going to show you, we're going to talk about the inventory of how to measure these 4 things, right? And then measure these outcomes. Okay, so here we go. So here are 5 statements, and we're going to do a poll, and maybe you can see the poll pretty soon. But what we're going to do is have you rate these statements on a scale of 0 to 5. 0 means I went through, let's relate it to COVID. I should have said that. Everybody, we're going to use COVID experience, the collective COVID challenge. And from COVID, say how, on a scale of 0 to 5, how true this is for you. So take a moment to do the poll. Hopefully everybody can see the poll. Can everybody see the poll and go ahead and vote?
We'll take just about another minute for the poll, Lori.
Okay, sounds good. I see people are filling it out. A lot of people are filling it out, so. Wow. More willing to express my emotions, develop new interest. Mm-hmm. Let's take another. Okay, here's where I think most people have taken it. Boy, this is interesting. Wow. Okay. So here we go. So I'm going to share the results. All this technology. I hope you all can see the results. Okay, so most people, I am willing to express my emotions. It is about a 4. It's averaging about a 4. So that's the, I'm more willing to express my emotions. That is 4 is pretty strong, okay? And so number 2, I've developed new interests. It's pretty much across the board, with 4 being the strongest. Yeah, COVID, the situation with COVID around developing new interests, it might, for some people, it might be very difficult to develop new interests when you're in isolation. Okay, and then I've developed a greater sense of self-reliance. Wow, look how heavy those are on the 4s and the 5s. A greater sense of self-reliance. And number 5, look at this, you guys. I have a better appreciation for spiritual and existential matters. That one is the strongest by far so far. And, oh no, this is, well, it's about the same. Actually, 4s and 5s. I have changed my priorities about what is important. Change my priorities about what's important in my life. Look at those 5s on that one. So if we were going to do an assessment of post-traumatic growth, just with our group right here, we're scoring pretty high. We're in the 4 and 5 range on each of these. Now let me show you how that works. Okay, number 1, I am more willing to express my emotions. That's correlated with relating to others. Number 2, I've developed new interests. That's the new possibilities domain. Remember with the 5 domains. I've developed greater self-reliance, personal strength. I have a better appreciation for spiritual or existential matters, spiritual existential change, right? And then changing my priorities about what's important in life, that's this appreciation for life. So these questions are related to measuring whether or not that growth area has occurred, okay? So what we have here is the post-traumatic growth inventory. And there are 21 statements. And all of them have to do with a domain in post-traumatic growth. In your packet, I gave you the ways to score this. So let me tell you, so this is a good tool. Tadici and Calhoun developed it. They developed it to measure growth. They give this, have people fill this out as an assessment of whether or not growth has occurred. What we use this for, I use this for quite a bit with teens who have gone through the cancer experience, and also with parents who have gone through cancer with their child or experienced the death of a child. And we use this more as a conversation rather than just an inventory that someone's going to fill out. So, and also if you think about, if you're reading this, like number 4, we did, I have a greater feeling of self-reliance. I'm better able to understand spiritual matters. Number 6, I see more clearly that I can count on people in times of trouble. So sometimes, whether or not we're measuring that by a number, we're just talking about it, brings it about. The awareness, one may not be aware that that has happened inside of them. Bringing it out makes it more possible, makes that outcome more real for the person. So it's really, it's a healing, it's an instrument to measure, but it's also an instrument to facilitate healing conversations. So I hope you you can use this in your work, in your practice with your friends. This is great if you have teenagers, you know, and they go through something difficult. Afterwards, sit down. You don't have to go through the whole thing, but you can have some conversations about these statements as prompts about something that happens with the person. So here it just shows you, I want to give you kind of a little precursor if you want to use it and measure it. Each one of the statements relates to a domain. That all makes sense, right? And they relate to a domain, and then we can add them up, like relating to others, number 6, 8, 9, 15, those, so you add them up, and then that'll give you a score. Let me go back. Then you can kind of score that and then determine what an amount of growth is. So imagine if we did this with the entire community, and if we did a community assessment with the entire community about those 21 things that they may have 0 to 5 experienced with COVID, we would be able to identify where people's needs are, where people's growth has been, and also just in doing the assessment would help people to have conversations about the possibilities of manifesting growth in these areas. Do you see how that makes sense? Like having a conversation about it kind of sometimes makes it happen, or it helps people see through that lens that this is a possibility. You know, this is all about reframing our thinking, you know, organizing your mind so that you can think straight and you can see possibilities. So let's do a little bit of that right now with all of us together. All right, so here we go. So here's Maslow's hierarchy of human needs. And what we want you to do is we're going to go into little small groups. When you go into your small groups, the assignment is to identify how our community's needs were disrupted by COVID at each of these levels. We'll leave hope. Don't do hope yet. We'll talk about hope that would come later, but basic human needs, safety and security, love and belonging, emotional well-being, the impact of COVID on these elements. This is identification. What we're doing is identifying. So what I want you to do when you get into your groups is find the person in your group who has the most experience with Zoom. Because usually you try to pick a leader. Just find out in your group who knows Zoom the best, and to be more specific, who can use the annotate feature on Zoom. Okay, whoever can use, if there's no one in your group, don't worry about it. We got your back, because we'll be coming back and we'll be filling this out together. So I'm going to ask Annie to put people into groups. Let's say about 6 people, 5 to 6 people in each group. Does that work?
That works. And how many minutes should we allow for this breakout room?
Let's do check our time. I'd like to give people enough time. Let's do 7 minutes. No, 5. Let's do 5 minutes. Sorry, 5 minutes. So got to be quick, you guys. Okay. So those of you who had a participant with that knew how to use the annotate feature, so we'll start at, you can start writing down in here how our basic needs were disrupted. The community's basic needs were disrupted: food, clothing, shelter, etc., down in this bottom rung. So for example, let me put our thing. So we had food insecurity. Go ahead and share in the chat if you don't know how to use that function, and we'll go ahead and we'll put it in for you. Okay, so housing insecurity. And then these, and let's go, and we go up to safety and security. We can look at, oh wait, hold on. Okay. Safety and security. We had job losses, just not knowing whether you're going to keep your job or not. Fear of getting COVID. I've moved up to the next one, so go ahead and keep going on the pyramid. What we're going to do is we'll share these. We'll share. Sorry, we'll capture all of these and we'll share them. We'll keep this. We're going to take a screenshot of this. Love and belonging, loss of important relationships. Yes. So, and then also like the inability to, one of our participants talked about inability to connect with people, especially for extroverts. Okay. Emotional well-being, mental health, psychological stressors. Okay, well, so we'll go ahead. Psychological stressors. Oh, sorry, I can spell. Stressors. There's many ways to spell words, right? Okay, so here we have just sort of a snapshot of our basic need disruption. And I'm going to take a screenshot of this unless anybody else has anything else to add. Okay, afraid of, yeah, okay. Yeah, if anybody has anything. Oh, afraid of feeling the shame of having COVID. Yeah. All right. I think, yeah, grief. Yeah, grief. The loss of so many loved ones. Emotional well-being. Yeah. I'm going to, we also, I'm going to add up here this kids not being able to go to school. Okay, so here we have identified, we've used Maslow to identify disrupted needs. Okay, we get a screenshot of that. Perfect. And then we can move on here. Okay. Great, thanks everybody. All right, so, oh, not knowing how to use it. Okay. We have to add that, okay. Now, next assessment. So that gives us that right there, that activity gives us a real strong framework to start to identifying how our needs have been disrupted during COVID. Okay, so the next one, we talked about the hero's journey. So in this next one, what I want you to do, we're going to break you into groups again. Let's make the groups a little larger this time because it's just going to be a quick discussion, maybe 3 minutes. Go into your groups and come up with, and Annie, can you make the groups 7 to 8 people? And everybody, okay, everybody can vote on where you think we are in our hero's journey through COVID. What time is it? Like, where are we? Are we at the denial and refusal stage? Are we just crossing into the threshold? We're just beginning the difficult part. Are we down at the pit? Are we in the abyss? Is this the worst of it? Are we a glimmer of hope, the boon? Are we at the point where we're learning the treasures of the experience and what we can take back to the other world, back to ordinary life? Where are we on this journey? So go to your groups, vote, and come up with a number where we are on the clock. Okay, here we go. Wow, that was interesting. So our group, I'll go ahead and share for our group, and then go ahead, please share for your group. We'll figure out where we are. Let me put the slide back up though, because I think that'll be helpful. Can you guys see the slide now? Oh, I can't see. Let's see, hold on a second. I can't see you all. Here we go. Okay, now you can see the slide. Okay, so those of you who want to talk, please just go ahead and unmute. And I don't know whether this happened in your group or not, but we were really afraid to claim a time on the clock of where we are, right? Because of fear that we might get right back here to the abyss. Did anybody feel that in your group?
Yeah, Lori, in our group, we talked about being, 6 to 8 and moving back down, depending on, people were scared about what was be said on the news, the governor, the president, and then also just like if you didn't have to pay rent because you lost, your job or anything, what's expectation when, that's lifted? Mm-hmm. So anywhere from 6 to 8.
Yeah, ours said 7. Anybody else? We were at 7.
Yeah, our group said around 7:30. 7:30.
Okay, so 7.5. 7.5.
Around there, yeah.
Yeah. Okay. Between the glimmer of hope for us was really the vaccines. It gave us a glimmer of hope, right? Okay. So anybody else? Groups? What'd you come up with? We're at 7. I think we're at 7:15 now, average.
The group I was in had a high of a 9, and I think 7 was the lowest. But we also had a comment that it really depends on where your position in the community and your resources and privileges.
That's so true. That came up in our group too. Thank you, Carol. Yeah, that came up in our group too. Which community are you talking to? There are some people who are here in the worst, maybe, or just in other places on the clock, depending on where they are and who they are in the community and what resources they have. Yeah. Okay. So now we've kind of like navigated now knowing where we are. The application of this theory to our real life is knowing where we are and moving on from there. So let's say we're at 7:30, 7:45, 7. Okay. Knowing that we're in this glimmer of hope. Now the next phase, next stop on the hero's journey is learning. What are you going to bring back? Because we have a glimmer of hope to getting back the road back to the ordinary world, right? So now maybe our community's time of reflection. What have we learned in this experience that can lead us to become masters of 2 worlds with special knowledge of both of these experiences, life before COVID, life after COVID, life with COVID, COVID life, ordinary life. So this is the choice point, and this is where we together as leaders and sharers of this information can move our community up to growth. And we do that with post-traumatic growth theory. So we identified, we navigated, and now it's time to cultivate. We're going to cultivate these that we know are precursors to growth, so that, since we're right here, so that we can move up and experience the growth that can come after trauma. All right, so we have these 4 factors. This review: sense of control, positive coping style, social support, positive sense of self. If we can nurture a restoration of our control in our community, we can lead a community towards health, hope, and healing. Okay, so here you have those 4 things. We're going to break into a group one more time, and we're going to take responsibility on some level. And I'd like you to choose a leader and to speak for your group. We'll come back. We'll do about groups of about 6 or 7 people again. Have a talk about who do you know in the community who can help restore a sense of control? Who do you know that can help us with positive coping styles? Social support. I know at Jacob's Heart, we're starting to get families back together because we know the importance of that social support of getting through this. Positive sense of ourselves. And I think with these are really singular person, individual written, but let's think of it in terms of our community, a positive sense of our community, a restoration of the belief in our community, sense of control. And I think Annie's going to put in the chat notes for you so you can remember these. I know going into the group, sometimes it's hard to remember. Wait, what was that, right? So let's go into the groups, identify organizations, individuals, places in our community. They can be local, regional, national resources that we can use to nurture these 4 elements so that we can achieve post-traumatic growth. Okay, here we go. You got it? You ready? Okay, here we go. We're really close on time. So if someone wants to just share what you talked about, maybe just a couple of people. Susie, would you share? Because I think some of the things that you guys said was really, really helpful.
Yeah, so I think that the answer to this question is really all the same. So, you know, schools, community organizations, I saw Heidi on here, her running groups, churches, the Azteca program, you know, other community organizations, if they're, for instance, providing social support, they're also building in a positive sense of self-worth and coping skills and a sense of control. However, it really depends on the individuals in that. And sports is a great example. So if you have a coach that is speaking words that take their players down, it's not going to provide, that team is not going to provide the coping style, the support, and a positive sense of identity. It actually can hurt. And it's kind of crazy to think that actually is happening even right now. So
how about this idea? What if people were aware that these 4 factors are tried and true, they're evidence-based, of leading people to grow after the trauma of COVID. And that coach knew that it was really important to nurture a positive sense of self. Maybe they had a little card that just said, these are some things we're going to focus on. These are focus areas. Let's give strong social support to our teens, to our kids. Let's just really take it to the, you know, to the limit on how much we can really nurture in these areas. Maybe we choose one, you know, that we become a community where we're really helping people restore a positive sense of self, a positive sense in our community, restore that sense of pride. And so we can own a few of those, or an organization can own those, that you take this place, that take this part in the community to build that back, because these have been disrupted. So let's build them back. And then, sorry, we can go back for just a second. We're almost running out of time. Sorry, I'm going I get so passionate about these things. So, so now, anybody else have any ideas about how we might be able to nurture these in our community to lead our community back towards that growth trajectory? Think about the hero's journey. We're going up and above after this. Any other organizations? Anybody? Keisha, I see you there from United Way. I think United Way has a real important role to play in this. Could you share? Wait, you're muted. Here, I'll unmute you.
I was clicking the button.
That pipe.
Yes. We're here. We're happy to help in that coordinated effort of you having access to a lot of these supports. Our 211 here in Santa Cruz County, it's 24 hours a day, 7 days a week, 170 different languages. You can call, you can text your zip code to 211-211. If you don't want to talk to a live call specialist, you can visit the website, 211santacruz.org. But our role in this community is to make sure that we have all of your programs and services at our fingertips so that when a person dials those 3 numbers, 211, we can help connect them to all of your programs and services in all of these areas. And that has been the biggest thing. And just to be able to support our community 24 hours a day, 7 days a week. The role we played during the fires and helping to evacuate people and place them in hotels, partnering with our county, looking to you all of these amazing leaders on this call today. This is what it means to live united. This is what it means we all have a role in these areas.
In terms of setting a framework and a renewed consciousness within our community about the possibility of becoming a better community, not in spite of, but because of our experience, our collective experience going through COVID. So the United Way is a resource where if each of us commit to taking this consciousness, this knowledge that we have knowledge now of these 3 theories, how they work. And now, wisdom is applying knowledge to real life to make things better. That's wisdom. So it's an application of knowledge. So if we make a commitment to applying this knowledge, you can start to see how we can achieve growth. And so I hope that we can have more conversations like this, that this is the beginning of many conversations about how communities can heal, and that this community can become a model community for how we came together to nurture growth, to set the stage to become a community that believes that we can be better as we emerge from this incredible trial. So with that, here are some resources. Now, this is not a complete list. And, we have 211 on here. But if you will please send additional resources. If you have them, please put them in the chat. We'll keep it open, and we're going to save the chat for people to look at afterwards. If you can see additional resources, these were just ones I kind of had at my fingertips, and Gina shared a couple. So if we can get a collective, a whole list of resources, and that we could undergird this process with evidence-based strategies, I think we will emerge better. Okay.
So Lori, are you asking for like our individual organizations like Women Care, or just?
Sure. Yeah.
Okay.
Where it's organizations where people can go that for support, for mental health support, and also that your organization is committing to taking a part in this community healing project. That will be, you're willing to participate, you're willing to nurture those 4 elements towards the path to growth and lead people towards the path to growth after COVID.
Okay.
Yeah, I know we can count on you guys. Sure. Yeah, and we're opening the McDill Center for Creative Healing at Jacob's Heart. You guys got to come see it. It's just this beautiful place. And so we're expanding our healing center to really healing, helping the community heal in the wake of this tragedy, this difficulty. We've all lost a lot, you know, and together we can come through better. All right.
Look at that. Thank you, Lori. Amazing. That is so amazing. It's been amazing. We're over time. We're running out of time. But I want to thank everyone for joining us. I want to thank Lori for the great presentation of Word. This is all recorded. We'll have it on our website, the presentation on our website, how we come to this as a community, but just being aware, having these tools that we can have to help us, you know, measure ourselves, measure our community, measure our friends, so we can help our friends, we can help others, we can set ourselves up, and knowing where we are at in that process on that clock and how we can continue to move forward as a community and as individuals in this community. So thank you all for the time of being here. Thank you, Lori, for the great presentation, the great word, and thank you all in the chat for you know, participating and being engaged. And we will try to share this information and more as we get out from the Community Health Trust. So thank you all again, and have a great rest of your day. Thank you.